There are several different causes of burns. Thermal burns are caused by direct heat from things such as fire, steam, hot objects, or liquid. Radiation burns are caused by exposure to radiant energy, most commonly seen as sunburn. Electrical burns are a result of electricity passing through the body, causing rapid injury, most commonly seen as lightning strikes. Chemical burns happen when the skin is exposed to a corrosive substance or inhaled as a gas, most commonly seen in the wilderness with leaky batteries, forest fires, or spilled gas.
Some of the most common burns in the wilderness are caused by campfires, stoves, lightning, and the sun. First-degree burns are superficial burns that affect the skin's outer layer called the epidermis. Signs and symptoms of the first-degree burns are the skin is swollen, red, tender, and painful. Second-degree burns extend through the epidermis into the inner skin layer, called the dermis. Signs and symptoms are moderate to severe pain, swelling, and blister formation. Third-degree burns extend into the underlying layer of fat and muscle. The skin becomes numb, looks charred, leathery, and does not change color when pressed because it is dead. Burns are considered serious and victims should be evacuated if the burns involve the face, hands, feet, or genitals, circumferential burns, which are burns that extend completely around the body or the limb, burns that involve the respiratory tract, causing severe cough or shortness of breath, or burns that are associated with illness or injury. The extent of burns are determined by the rule of nines, which are common guidelines used to accurately explain total skin surface for each part of the body that has been burned. Each part of the body is given a percentage. The head is 9%, each of the arms is 9%, each of the entire legs is 18%, the entire back is 18%, and the entire torso is 18%. 1% of your body is equivalent to the palm of your hand.
Always be cautious of your surroundings so you can prevent injuries like this.
In the event of this type of injury, you need to neutralize the burn by immersing it in cold water for at least 10 minutes to relieve the pain.
With a more severe burn, you would need to check the patient for additional injuries and also take note of their airway, breathing, and circulation.
Be sure to remove any jewelry, constrictive clothing, or anything that can cut off circulation before swelling occurs, and to prevent infection.
After cooling the burn, apply a dry, sterile dressing to cover wound from any bacteria. Be sure to apply dressing carefully to wounds so it doesn't pop any blisters because the fluid minimizes infection.
Every 12 hours, be sure to change the dressing to reduce infection and monitor how it's healing. You may also apply aloe or burn cream for the pain.
Need be, you can give the patient aspirin or ibuprofen to relieve pain and inflammation.
Lastly, allow the patient to rest, stay hydrated, keep the injured area elevated, and give them a little tender love and care.